I'm Dr. Rick Greene from the UVA Medical School class of 1970, and it's my pleasure today to be with Dr. Bill Petri, who's professor of medicine, professor of infectious disease, and a well-known researcher here at the University School of Medicine. And Bill, it's a pleasure to have you here today.
Oh, thank you, Rick.
Thank you very much for coming.
You're welcome.
So, where did you go to undergraduate school?
I went to the University of Wisconsin.
In Madison.
That's right. Yeah.
Wonderful place.
Yeah.
How did you know about the university here to come to med school?
Well, I grew up in Northern Virginia, so I knew about UVA, but ended up in Wisconsin because I'd worked at the National Cancer Institute, and the person I worked with had gotten his PhD at Wisconsin. So
You had all the wonderful lakes up there in Madison, did you?
it is, yeah, and very cold. I still remember like that. In September, wearing my winter coat from Virginia, and everyone's asking me, well, where's your winter coat? And I say, oh, this is my winter coat. I say, no, where's your winter coat?
A real winter coat.
Yes, yeah. So I was there for like 3 years, and then came here for the MD PhD program.
Wonderful.
So, yeah.
It's wonderful. You were the class of '83, I think?
Well, I entered in '76, and I had like 2 separate graduations with a PhD in '80, and then with a medical school class of '82. So,
'82, right.
Yeah.
Okay. And how did you gravitate into your career path of infectious disease and clearly the work that you've been doing today?
Oh, well, it's actually, I was still interested in cancer research when I joined the MD PhD program at UVA, but in 1976 there was very little going on as far as cancer research, but there was very strong virology, and so I ended up getting a PhD with Bob Wagner, who at the time was chair of microbiology.
Gotcha. What's your involvement with the students and the undergraduate students in the medical school? Obviously you have involvement with the house staff and things like this, but what about the students themselves?
So, well, true undergraduate students in the college, I teach a class every winter that I call Bill's Bugs, and we do like a different infectious disease over dinner at Hereford College every week, and so it's fun because it's like 8 students and opportunity to get to know the undergraduates.
What is your favorite infectious disease?
Oh, probably amoebiasis, because that's the parasitic infection I've studied for like 30 years or so.
Excellent. Well, I know you know Dick Garant, and you've worked together with Dick.
Yes, and Dick is actually the reason I'm doing what I'm doing, because he lectured us when I was a medical student, and realized very strongly brought across the point of how important infectious diseases were in low middle income countries.
Tell me about your involvement in global health. What have you done outside the United States?
So I mostly work in Bangladesh, and so we actually just got a new NIH grant that's called the Maternal Child Health Global Network, and so we're part of like UVA and Bangladesh is part of an 8 international site clinical trials network, and so one of the studies we're just going to be starting is to give the antibiotic azithromycin to women when they're in labor, with the idea that you can protect both the mother and the newborn child from infectious disease, and so that's going to be an exciting sort of brand new thing that we're setting up.
So you're really just starting this trial?
This is brand new to be part of this network, but I've been working in Bangladesh for about like 25 years. So.
Do you take students or house staff over with you when you go?
We do, and the school has been like very supportive of having students and fellows there, and I say that because there's a travel warning for Bangladesh because there was a terrorist incident there a couple of years ago. But there's a very, very thoughtful review process by which students with the proper precautions can be approved to go there. So it's been a good thing about UVA.
When you stepped down as chief of infectious disease here, I think you recently stepped down?
That's correct, yeah.
Tell me about your work now, and especially your research work. Is it dealing with the issues in global health, or is it other areas too?
Well, there's a lot of global health, but then also study Clostridium difficile colitis, and I do that because when I attend on general medicine or on infectious disease, it's such a common infection, and I've had patients die under my care with C. diff, even though it's a bacteria for which is very susceptible to antibiotics, and so it really kind of made the point that we need to do something in addition to antibiotic therapy for C. diff, and so that's been a very important part of my research led by graduate students in the microbiology department.
Have you been involved with the surgery department in that sense? As a surgeon, of course, C. diff, colitis is so
Yes.
important in my work,
Yeah.
and I was just wondering what the Department of Surgery was doing with it.
Yes, and so actually with the Department of Surgery at Hershey, PA, actually, as it turns out. So Carrie Guard and Erica Bonoma were graduate students with me, and they published a paper in Nature Microbiology that eosinophils were very important for defense against C. difficile in a mouse model. And David Stewart, who's a surgeon at Hershey, PA, read that paper, and he said, well, if that's true in mice, that should be true in people. And so he called me up, and he had looked at 1,000 patients with C. diff. He's a colorectal surgeon. And if you didn't have eosinophils in your peripheral blood, you were 2.5 times more likely to die of C. diff, much more likely to end up in an ICU, have your colon resected. And he called me up and he said, like, oh, no, you've got to be a co-author on this because you inspired this paper. I said, well, I can't do that because I really haven't done anything, but can we look at 1,000 patients at UVA? And we did, and we saw exactly the same thing. And so we're actually like working together now along with the University of Michigan to do this prospectively and sort of see, does this really work going forward? Is the eosinophil count predictive of a good outcome if you have eosinophils present? And then the research in the lab is oriented to how can we promote what's called a type 2 immune response that promotes eosinophils, and could that be used in addition to antibiotics to help people survive from this infection?
So you're involved with the MD, PhD students that are currently here, or how have you become involved in it?
Yes, and so Alicia Gilmartin just graduated from my lab working on amoebic dysentery, and then Shio McCowan is a current MD PhD student, and he's working on cryptosporidium, another parasitic infection of children in low-income countries.
Sure. No, I know we've had a wonderful MD PhD program. We have other MD associated programs as well. I know with the law school, even with the Darden School, some of these have come.
Yeah, and to me, like that's like one of the most important things because you know, as physicians and surgeons, we know like every single patient that we see, we don't know the right thing to do for them. You know, we know a lot more than when I was a medical student in the 1970s, but every single patient, there's knowledge gaps. And so it's really, it's on us to like find the solutions. And if you can work like really closely with microbiologists, which I've been able to do during my career here, the microbiologists know the right techniques, the right approaches, but as physicians and surgeons, we know what the important questions are. And so that's been like the fun part, I think, for me, and just like leading the division of infectious disease is having like that research arm to things, as well as like being involved in graduate education.
Tell me what you like to do outside of medicine.
Oh, I play trombone and I run marathons, so that's...
Not at the same time.
Well, on the same weekend, actually, so...
Really? Do you play in a band?
We actually had a quartet over the summer of everyone, and then all 4 players had run marathons. So it was a very fit jazz quartet. I mostly, and that sort of has fallen by the wayside right now because our vocalist is actually on sabbatical in Florence, Italy, so we have to wait for her to come back in January. So
I see. Well, I just want to salute you for all the wonderful work you've done, and clearly your work is not over. It sounds like you have so many exciting things going on now, and important things around the world as well as in your research lab.
Oh, no, thanks very much, Rick. Yeah, this is a great profession, great career.
So we've been talking with Dr. Bill Petri today, and got his MD and PhD here at the University School of Medicine. Bill, thank you very much for being with us.
You're welcome.
Really appreciate it.